adolescents have always had mental health issues. So during COVID and during the lockdown, one of the key things that came up is the need to provide mental health support to different subpopulations, and adolescents was one of them. And therefore, we wanted to carry out a study, one, to document what is the burden of mental health problems among adolescents in the context of COVID-19, but also two, to really work closely with civil society organizations to be able to strengthen the community response to mental health issues among adolescents. We set out and carried out a formative study in 3 counties in Kenya: Mombasa, Kilifi, Nairobi, and 1 region in Uganda, specifically Kampala. One of the key findings in our study, which of course is not that surprising, is that there is a heavy burden of mental health problems among adolescents in general, but actually heavier among those who are out-of-school adolescents. So you find that, for instance, among out-of-school adolescents, 1 in every 3 adolescents has presented with some form of mental health problem.
In lines of intervening and reducing the high burden of mental health disorders, we contextualize and adapted 2 mental health interventions. Firstly, mental health literacy program is a program that aims to create awareness, increase help-seeking behavior knowledge, supporting adolescents on where to seek help, how to take care of themselves, how to address stigma and myths surrounding mental disorders, among others. The second program was Shamiri Wellness Program. It's a program that aims to reduce the high burden of mental disorders.
We have now rolled out this program within several schools, working with more than 10 civil society organizations.
The role we played as Zumari Africa in conjunction with Aga Khan University is that we were able to get capacity building on mental health among the adolescents. And some of the topics that we covered during our training included how to address stigma, how adolescents can also seek help, and even some of the common mental health disorders among the adolescents. After that, we were able to go to the field where we implemented the project in primary and secondary schools. And through our intervention, we were able to also form partnerships with other organizations that were part of the training of the civil society organizations.
We're mainly focusing on breaking the stigma, enabling young people to understand that mental health issues or disorders can affect anyone, regardless of the age, regardless of the background.
We learn many things. For example, a mental disorder. For those who have a mental disorder, they need our support, and we should not isolate them. And we also learn that anybody can get mental disorder.
We also learn about how to take care of ourselves by doing regular exercise, and also by keeping ourselves busy, like reading, and also activities like sports. Lastly, we learn about where we can seek help from our teachers, guardians, and also guidance and counseling.
I'm able to go outside there and teach others about mental health and mental illness and what they can do to avoid this.
The students now have more confidence. They are more resilient, instead that when they have issues, they don't have to balloon up. We've seen that resilience through the students going to the guidance and counseling, trying to open up.
We truly thank the Aga Khan University for this.
Thank you, Aga Khan!